I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go over the 3 best exercises for Piriformis Syndrome. So what is Piriformis Syndrome to start off? So I only address this because so many people Google and they come in and they say, oh, I have Piriformis Syndrome. So the Piriformis is basically, and the best way I can describe Piriformis Syndrome is you have a pain in your butt, literally. You can go, it's right here. Now, this is not to be confused with an SI joint problem. So if you have a pain that's like right here, that's SI joint. Totally treatable, but it's a completely different problem than Piriformis Syndrome. So just be aware of the differences. The SI joint is up here. You're going to have that uncomfortableness. The Piriformis Syndrome is going to be like, I have a pain right there in my butt. Now, Piriformis Syndrome could cause numbness and tingling going down your leg. You may not have a pain in your butt, but still have some piriformis issues going on. You could have numbness and tingling in your butt, have Piriformis Syndrome, have SI joint issues, and have a bulging disc. So the fun thing about the back is that a lot of times it involves more than one issue going on. So just be aware that there could be several things happening at the when you diagnose yourself with Piriformis Syndrome or you are diagnosed with Piriformis Syndrome. But a lot of the symptoms of Piriformis Syndrome hurts when you sit. Like that's the number one thing. Can't drive for too long. Can't sit for too long. I have to shift off my butt. A lot of times you'll see people with Piriformis Syndrome kind of leaning to one side, lifting their glute up, getting that pressure off of that muscle. Piriformis is just a little muscle that is in the glute. It's about right. It's back in there, across your butt. So you're going to have pain with sitting. A lot of times when you stand up, it's going to be relieved. But again, because Piriformis Syndrome doesn't always exist in a vacuum, and you don't just normally have Piriformis Syndrome, you have a lot of other things going on. Even when you stand up, it may not be relieved. But a lot of times walking, swimming, gentle exercise will relieve that. But if you sit for too long, you're going to start to get the pain. You're going to get the numbness and tingling. Piriformis Syndrome sometimes can flare up at night with sleeping, depending on your sleeping posture. We've talked about sleeping posture before in terms of, on your side or on your back is the best. Piriformis Syndrome, especially if you go to bed with it irritated, which happens a lot of times because you're sitting and watching TV, then you go to bed. Once you're sitting, unless you take the time to loosen that piriformis up, kind of get some of the blood flowing, you're going to get some irritation. Causes of Piriformis Syndrome, I don't know. There's like a million. So there's really no direct cause of Piriformis Syndrome. There's not something I would say, well, yeah, if you did X, you definitely have Piriformis Syndrome. Piriformis Syndrome is a compensation injury, meaning it's coming on over time. You have changed the way you've done a few things, and that has caused the piriformis to shorten and become inflamed. So maybe you sit for too long, maybe you ran, maybe you stepped down off of a curb wrong. Whatever you did, you've caused some compensation in your body. And Piriformis Syndrome doesn't happen overnight. It's not a traumatic injury. So if you get hit by a car and the next day you're like, oh, I have Piriformis Syndrome, it was not from the car accident. Okay, it's not going to show up that quickly. It is a compensation issue. So it is something that, it's going to take a little bit of time to develop. It's something that's occurring because you're either sitting wrong, standing wrong, walking wrong, running wrong. You hit a pothole when you were running. You were working out. You've compensated with some other muscles. That's something that, we can kind of go through if you come in and for a consult and you have possibly Piriformis Syndrome. We could talk about more along that compensation and how that appears, but it is a compensatory issue. So it is not a traumatic. You're not going to fall on your piriformis. You're not going to fall on your butt and the next day be like, oh, I have Piriformis Syndrome. You may have a contusion, you may have a bruise, you may have bursitis, you may have something else, but you're not going to have that necessarily, that pain in your butt. Another thing that is often confused with Piriformis Syndrome, and people when they Google, depending on which sites they wind up on, can wind up with more of a bursitis, okay? So if on your sit bone, which is lower, okay, a lot of times they're referred to as your sits bones, where you sit right on it, that a little bit more towards the top of your hamstring, that's a bursitis, okay? So that's a totally different topic and issue and things like that. but that's not your piriformis syndrome. Your piriformis is going to be right there, well, not a little, but a pain in your butt that can be excruciating and make it difficult to drive, make it difficult to run, walk, work, sit for long periods of time. But this is kind of the three things we're going to go through, what you can do to relieve piriformis syndrome. The first one, when talking about piriformis syndrome that you need to do is move. And I mean gentle walking. Do not sit for too long. Do not lay down for too long. The muscles need blood flow. So there is no specific exercise other than you're going to set a timer every 15 minutes at work. And I don't care if it's just you stand up and you walk around your chair, or you stand up and you answer a phone call and you're just shifting back and forth. But what you're going to do is you're going to get up and move. No more than 15 minutes in a stationary position, meaning sitting, standing, or lying down. When you're standing, you're moving. When you're sitting, you're fidgeting. When you're lying down, obviously, can't really do too much. You're probably sleeping. But the first thing you can do with piriformis syndrome is move. Now, a lot of people can't do that all day long, or they drive for a living and whatever. And honestly, moving is not going to fix it, but it is going to, you don't want that piriformis to get to the point where it's screaming and you're having pain while you're sitting, and you're having pain while you're driving. Okay, that means you've aggravated it, and you want to make sure that you calm it down. You want to make sure that it doesn't reach that point. It doesn't reach that point of severe pain. So if you can only sit for 5 minutes before that pain comes on, then you sit for 4 minutes and you stand up and you move, okay? And you allow that onset to come on a little bit later by getting up and moving. And again, it's a gentle movement. It's a walk around a chair. It's a sit back down, okay? It's a stand and answer a phone call. It's a shifting weight, all right? But get up and move so that way you allow that blood to flow to the muscle. The next exercise you're going to do is you're going to get a tennis ball. You're going to get a BC ball. We have our little spike balls here. And you are going to roll it out, okay? You can have a lacrosse ball. I prefer spikes. It gets in there and it breaks up the tissue. Anybody who has one of these, which most people who come into our clinic do wind up with one of these, swear by them. They are great. But what you're going to do is you're going to sit on it. Now, you're not going to sit on it all day. You will cause yourself so many other problems in the other direction if you sit on this all day. So you're just going to literally take this and you're just going to sit, and you can do this in your desk chair, and you're going to roll around, okay? 5 minutes. That's it. You can do this every hour for 5 minutes, but 5 minutes. Do not sit at your desk with that underneath your butt and type, all right? You are going to mess up a lot of other things. Piriformis syndrome is easily solved if you handle it the right way. If you sit with this underneath your glutes all day, you're going to mess something else up, and that's a lot harder to solve than just a strict or simple piriformis issue, all right? So get a lacrosse ball, get a tennis ball. I'm going to tell you right now, a tennis ball, if it's not in a severe state, tennis ball is going to have a tough time getting in there and breaking it up. Lacrosse ball's a little bit better, and then our spike balls are the best because they are hard and they have spikes in them. So anything you can get under there and break up that tissue a couple times a day, but again, for no more than 5 minutes. Do not sit on it. Can you tell I've had several patients come in here, more than several, throughout the years that have done just that and just taken a ball because somebody said, oh, well, you have piriformis syndrome, sit on a ball. And they sat on it all day, and now they're in agony, and we have other issues to fix that are harder and longer than, had they just come in and seen us for piriformis syndrome. The next exercise is an exercise that you can do in a couple different places, in a couple different directions, okay? There's 4 basic ways you can do this next one. The first way I recommend is sitting in a chair, crossing your ankle over your knee, sitting up nice and straight, and then leaning forward, okay? You're not slumping forward. You're going to lean forward. You're going to feel a stretch in your glute, in your hamstring, all right, maybe in your back. Wherever you feel that nice, gentle stretch, you should stop. And I say this is my favorite position to stretch out in because you can do this while you're sitting at your desk. You can do this while you're sitting at a meeting, all right? And all you have to do is let gravity go to work, all right? You don't have to push on it. You don't have to do anything extra. You just sit with your leg crossed like this and let gravity lower your knee. Now, if you are someone that cannot get to this position, which there are a lot of people, especially if you have piriformis syndrome, that's okay. I'm going to show you another variation to do this. So the next variation you're going to do is you can prop it up on a table, on a couch, on a chair, just like this, okay? Now these tables are pretty high, so they're really good height for it, but if you can't get your leg up high, find a surface where you can put your leg up and leg straight across. You may feel a stretch right like here, all right? No problem. Here's where you stop. You may be able to, again, stand up straight and hinge forward at your hips and come forward. And you might feel a stretch with that. Again, you're going to stop where you feel the stretch. You don't want to slump all the way down here, okay? You don't want that, your back to collapse like that, all right? You can also do this on the floor in a figure 4 position, or you can do pigeon if you're into yoga. That would be the version, the yoga version of it. So there's a couple different ways that you can stretch out your piriformis. Those two that I showed you are generally the most convenient and the best, especially if you're at work. You know, I mean, you can prop your foot up on your desk. You can always sit down and have your leg propped up on your knee like that. Minimum hold is 30 seconds, 6 times. All right, so you can do it for about a minute and then move on to the next exercise, whether it be this or just a movement exercise. But you do want to make sure that if you are starting to get any sort of pain in your hips, pain or dysfunction in your back, that's a really good stretch to do no matter if you have Piriformis syndrome or not. You want to take notice that if it fires up any numbness and tingling, you want to stop it immediately. If it causes you any severe pain, you want to stop it immediately, okay? And then seek help from your healthcare professional. If you do suspect you have Piriformis syndrome, it is not easy to get rid of on your own. So if it's gotten to the degree where you are Googling it, it's already beyond the past of the point where you can take care of it at home.